In this video, we shall discuss classical indicators of metabolic health that are considered mainstream in the current healthcare. Why they are on most occasions not ideal to give us the best picture of our metabolic health, and on quite a few occasions they actually represent delayed signs of what is already a metabolic dysfunction. And of course, we shall look into how we can already now proactively assess, improve, and monitor our metabolic health for the lowest risk of chronic disease and optimal physical and mental performance. Let's start with what we understand by the very term metabolic health and why exactly we should bother about it. Metabolic health reflects both how effectively our body can process and utilize energy from the food we eat, and represents a state of optimal function of all the intricate chemical processes that sustain our life. And while metabolic health is the foundation for overall health, performance, and longevity, its opposite, metabolic dysfunction, is one of the key drivers of the most deadly diseases of humanity, such as ASCVD, cancer, neurodegenerative disease, and more advanced forms of metabolic dysfunction as such, for example, type 2 diabetes. So if we would like to prevent these conditions or get them under control if we already have them, we must be able to clearly distinguish between good metabolic function and metabolic dysfunction, and do so in a very timely, granular, and at the same time continuous way throughout our life journey. Let's look at the parameters and the cutoffs that are considered classical indicators of metabolic health in modern medicine and compare them with the more subtle and efficient options that I use and work with my clients and that are used by other expert longevity clinicians. In assessment of metabolic function, modern medicine is looking at 5 parameters, which are sometimes called 5 pillars of metabolic health: waist circumference, blood pressure, and blood levels of glucose, triglycerides, and HDL cholesterol. The conventional norm for waist circumference is less than 102 centimeters in men and less than 88 centimeters in women. And we are specifically interested in this parameter because it serves as a surrogate marker for the assessment of the amount of visceral fat in our body. As opposed to subcutaneous fat located under the skin, visceral fat is the one that is metabolically active, and it produces different substances that negatively affect our metabolic and overall health. But if we think about how good this tape measurement of waist circumference is as a tool to assess visceral adipose tissue, then it appears to be a very crude proxy. And we are best following a more nuanced approach, which is to perform a DEXA scan. With a DEXA scan, we'll be able to directly quantify the amount of this dangerous visceral fat tissue and also estimate muscle mass, which is the body's primary metabolically active tissue. And as we perform lifestyle supplement and or pharmacological interventions, we will be tracking DEXA 3 to 4 monthly to assess our progress while aiming to lower our visceral adipose tissue and increase muscle mass. With my clients, I normally aim VAT of less than 100 centimeters squared and less than 100 grams, and also below the 25th percentile for their age and sex bracket, which is linked with lower inflammation and insulin resistance. We also aim a pendicular lean mass index above the 75th percentile, as it is a good indicator and predictor of optimal glucose disposal, muscularity, and functional strength. The second parameter is blood pressure, and it is the unanimous current view that 120/80 is the healthy cutoff we should be aiming for. I advise my clients to check blood pressure regularly in both arms and go by the highest measurement. If you spot high blood pressure or a tendency towards a high blood pressure, the primary lifestyle leverage tool to improve it is actually exercise, particularly zone 2 cardio training, because it improves vascular health and endothelial function. Additionally, you can cut out junk food, refined sugars, and excess salt while increasing the intake of certain foods like green leafy vegetables, which are rich in magnesium and potassium, freshly ground flax seeds, and hibiscus tea, which are also going to be beneficial for your blood pressure control and optimization. The third parameter for metabolic health assessment is glucose control, and the classic goals here are fasting glucose of less than 5.6 millimoles per liter and HbA1c of less than 5.7%, or 39 millimoles per mole. And although I totally agree with these numbers in principle, there are significant downsides that I find to both of them. I find fasting glucose a somewhat lagging low-resolution indicator, because by the time we spot the elevation in this parameter, significant insulin resistance would have been present already for some time, maybe even for some years. So we have actually missed the golden window to intervene early. On the other hand, HbA1c, which is the parameter that shows us the average glucose across a 3-month period, this parameter is a useful metric of getting a kind of an overview for long-term glycemic control, but the downside of it is it completely hides the glycemic variability from us, so we cannot judge on any glucose spikes or troughs with this parameter. And this is why in my practice I prioritize dynamic testing like baseline and regular OGTT, oral glucose tolerance test, and continuous glucose monitoring over these 2 snapshot options of fasting glucose and HbA1c. In my reading, the best indicator of a good metabolic health pertinent to glucose management is to have the glucose control of a healthy young adult or a child. And thus for my clients, I set the objective of the average glucose levels below 5.6 millimoles per liter, with the best being in the bracket of 4.5 to 5 millimoles per liter. We carefully watch the glycemic variability as it reflects the efficacy of glucose handling by the body, and we aim the delta of 0.8 millimoles per liter for about 60% of time and a delta of 1.6 millimoles per liter for about 90% of time. And of course, we'll look at postprandial spikes, so how your blood sugar responds after a meal, and we consider it okay when glucose stays below 9 millimoles per liter and optimal if it doesn't rise above 7.8 and returns to baseline of below 5.6 within 2 hours after the meal. And lastly, there are parameters 4 and 5 for metabolic health assessment, which are 2 biomarkers from our lipid profile, namely triglyceride and HDL cholesterol blood levels. The conventional criteria of metabolic health pertinent to these parameters are triglycerides of less than 1.7 millimoles per liter and HDL of more than 1 millimole per liter for men and 1.3 for women. In my practice, and this is resonant with the most prominent longevity experts, I find it best to expand these 2 criteria beyond simplified cutoffs. I advise seeing high triglycerides as a direct consequence of excess carbohydrate consumption and insulin resistance, and thus I normally advise a tighter target of below 0.8 millimoles per liter for best metabolic function. We also need to consider that adequate HDL levels do not necessarily translate into their functional efficacy. That is, the ability of HDL to perform reverse cholesterol transport from the artery walls into the liver. And in order to ensure this HDL functionality, we must aim adequate ratio of triglycerides to HDL, which is less than 0.87 if we use millimoles per liter and less than 1 if we use milligrams per deciliter. Such healthy triglyceride HDL ratio is indeed a powerful proxy for adequate insulin sensitivity and translates into adequate HDL functionality, provided their levels are optimal. So as we can see, the mainstream so-called 5 pillars of metabolic health can indeed be used to spot existing metabolic dysfunction, but at the same time they're quite reductionistic because they don't allow us to intervene early to correct any issues. And I would agree that they are a reasonable middle ground and a must-have minimum if we're talking population scale state-funded healthcare, but for anyone truly interested in the best health and performance, waiting for the overt signs of metabolic dysfunction to appear is somewhat unreasonable, and we are best to adopt individual, granular, and proactive approach and utilize it as early in life as possible for the best outcome. Now, I'm convinced that only with an intrinsically driven continuous monitoring of our metabolic function, as opposed to externally triggered snapshots, we will be able to effectively leverage any imbalances as or even before they appear. If you're interested in a thorough assessment of your metabolic function, along with a deep dive into all other aspects of your health and performance, feel free to check my consultation and coaching links in the description below. And I see you again soon in the next video.